I think we tend to often prematurely focus on particular ways of looking at things. And we tend to create false dichotomies. We must do it this way or we must do it that way. And I just want to start out by saying I think there's a need to look up and to drill down. We need to do both. And in doing so, now maybe we won't go all the way out to the galaxies and maybe we won't go down to the carbon atom. But I think we need to remember that there are layers and layers and layers of determinants of health. And to believe that any one of those will, whether it be the genome, which is the current favorite among many, or whether it be some other thing, will unlock all the, will give us all the answers we need. Now, from a personal point of view, from early in my life, I've been interested in the structure of things. And taking things apart, well, all kids do that. Putting them together is another story. So I've always been interested in the structure of things, and then I got interested in the built environment and how that affected people. And then I sort of married my political sensitivities and values and started thinking, well, what are the structures that create inequality in our society, and what can we do about them? And these are complex problems. They're really, really complicated problems. They're not just complicated, they're complex. I'll make that distinction. And they require new approaches, I think, and they require new approaches in terms of our intellectual understanding, and they require new approaches in terms of our trying to figure out what we can do to make things better. And so what I'm going to show you today is an example of some of that work. It seems to me we're in a state of the world where there's lots of challenges to understanding. On the one hand, there's the sort of tree of life, which some of us learned, maybe the great chain of being, and this hierarchical organization with humans at the top and everything else at the bottom. But now we're getting these tangled masses of things being related to each other. And whereas that may have been a way of thinking about some kinds of problems, that way of thinking doesn't do us much good thinking about these kinds of problems. And then we have the brain, and we used to think that things were located in particular places, and maybe the new neuroscience isn't much different from that. But actually, there's probably 100 trillion connections in the brain. 100 trillion, okay? And to think that there's any simple story that's going to help us understand the brain, that this is where fear is located, or this is where greed is located. I mean, it's silliness, okay? But you can get a grant for it. And then, well, we won't go there. Particularly with somebody who has their hand on purse strings here. And then, there's this incredible explosion of stuff about networks and influences. And I just show you two networks here. This is from Nick Christakis' work on the spreading of obesity and the network of friends. And this is the Koch brothers' political influence network. So networks are important, okay, whether they be spreading political influence or whether they be spreading behavioral influences affecting obesity. And the problem is that the things we're looking at are so complex that this old way of thinking about billiard balls, about one thing causing another, just doesn't work very good anymore. We keep at it, we keep at it, we keep at it. If we only get the right color billiard ball, the right size billiard ball, if we make the hole a little larger, a little smaller, get a Kevlar pool cue, if there is such a thing. And we look for these magic bullets, okay? This has been, the history of the war on cancer, for example, looking for the magic bullet. It's a war, okay? So what I'm going to try and argue is that we're at a place right now where we may learn things from doing some of this, but we don't learn all the things we need to know. And a lot of the things we know, particularly as they relate to disadvantage, to the inequality in our society, require different approaches. Now, the problem is that our old approach leads us to stuff like this. So spin the dial, and you find that smoking can cause heart disease in men 25 to 40. This is from today's random medical news from the New England Journal of Panic-Inducing Gobbledygook. And You know, no wonder people are confused because they get messaging like this every day, right? Every day they're told that something's going to make them healthy, something's going to make them sick, something's going to, you know, whatever, improve whatever aspect of their life. These are simple stories, and this is where Baltimore comes in. And, you know, curmudgeon that he was, H.L. Mencken did come across some things that make some sense. So, for example, for every complex problem, there's an answer that is clear, simple, and wrong. And so I'm going to argue we have these complex problems that are important to solve. We probably won't get simple answers. That doesn't mean we can't come up with answers. And I'll show you some examples later on of some computer simulation experiments that we do to try and ask some questions about complex issues that actually would have some policy relevance. But this is all very theoretical. I want to go back. I want to hit the ground with a young woman who could be real. She's not. I made her up. But everything about her is real. Okay. So Marva is now 12 years old. Her parents have been unemployed on and off for most of her life, including the entire year before she was born. They move from apartment to apartment as one health or job crisis follows another, and are evicted because they're unable to pay the rent on time. Often they reach the end of the month with little money to spend on food or other necessities. An occasional treat following a payday for one of her parents is a fast food hamburger, fries, and a 32-ounce soft drink. They live in a neighborhood bereft of parks, but with a surplus of abandoned buildings and crime. School is a refuge for Marva. It is safe, and she has friends there, but the teachers are burdened by too many students, too few books, too little pay, and too little training. There's no recess, physical or health education, school nurse or counselor, or computer training. Some days she just doesn't feel like getting out of bed and going to school, so she just stays home and watches TV. Her mother has a minimum wage job, cleaning job in a mall an hour's ride away by bus, with a work schedule that changes unpredictably from day to day. She's employed on an hourly basis by a subcontractor to the mall and receives no health, retirement, or other benefits. Her father is a non-union carpenter, but works only intermittently due to the poor economy and because he had been previously injured in a fall from unsafe scaffolding. Because of the fall and lack of proper medical treatment, he's lost some mobility. Needless to say, her parents, maybe even with ACA, still do not have any health insurance and have to rely on public clinics and emergency rooms for care. This is a true story. I made it up, but it's a true story. There are too many people like this. There are too many young women and men who have no future because of this. And in fact, if we think about her life up to age 12, it's characterized by parental unemployment and poverty, a vulnerable occupational status for her parents, residential instability and poor housing, neighborhoods with low resources and high risks, inadequate schooling, food insufficiency and binging on fast or junk food, poor access to poor quality health care, high levels of stress and psychosocial risk, and all the physiological consequences. And those consequences are real, and they generate a whole set of current and future health problems. So if we want to think about the health of this 12-year-old girl, we really have to go upstream a bit to the set of conditions that's described in that vignette. Now, more and more, as we think about the determinants of health in populations, we come up with a cartoon that's something like this. That it's not just about medical care, it's not just about behavior, what people do or don't do, but there's a whole set of factors which influence individual health and population health. And they range from social and economic policies, institutions only of which is medical care, neighborhoods and communities, living conditions, social relationships, the behaviors which have been the predominant focus of so much work, and then of course the genetic and constitutional factors which get the big money right now. Now, to flesh this out a little bit, let me show you an example of a real kind of conceptual issue. We know that education is related to health, okay? But if we were to just intervene on education, we'd be ignoring all these other things. So for example, how much education somebody gets and the quality of that education is dependent upon the characteristics of their parents and where they live, what the community resources are, where the parents are able to move. The economists that I talk to say, well, when my wife and I chose, because it's always men, when my wife and I chose where we were going to live, we moved to a place with good schools. Well, that's not an option for many people. And then there are the returns on education, the work returns on education, and those are not evenly distributed. We know that. They vary by history of discrimination, a whole variety of other things. There's hazards and opportunities. There's income streams over the life course. There's a whole variety of tax and transfer policies which have an enormous impact on the lives of working poor and poorer people. It's not about the middle class, the earned income tax credit. The second biggest transfer program in our country is not about the middle class, it's about the working poor. And it's not even about the really poor who aren't working. And only then do we get behavior and stress. And anyway, it's complicated. Not only is it complicated, but it's complex because there are all these arrows feeding back on each other, okay? Or another thing, we know location, location, location. We know the zip code determines your life expectancy about as good as just about anything else. And that's related to a whole bunch of personal characteristics, but it's also related to the housing market and steering and access to information and public policies about subsidized and affordable housing and school districts, and all that then combines to and there are lots of arrows there. There's lots of feedback. These are all affecting each other, so we can't expect that pushing in one place is going to necessarily give us the outcome that we want. Now, since the 1940s, really, there's been, and I don't expect you to understand all of this. Believe me, what this is a conceptual map of complexity science, okay? And all I'll do is drop a few names, well, not even the name, Norbert Wiener, systems theory, cybernetics, and artificial intelligence. And this has led to a whole set of techniques to thinking about complex systems, which are only now emerging into public health. They've emerged a bit in terms of infectious disease. So we can simulate the flow, the H1N1 spread over the entire world, actually. But they're only beginning to enter into the areas we really want to know about. So complex system approaches, I think, are around, and they might allow us to simulate ideologic and policy processes and what happens when we intervene on them to population health. And I emphasize the simulation part because there are a lot of things we can't do experiments about. We can do them, but to actually do an experiment is just extraordinarily difficult, expensive, waste of resources. I mean, okay. So but I don't want to be evangelist here. So I'd say these simulations can be seen as complements to other ways of knowing how and when to intervene, such as all the usual candidates. But they do require a lot of computing. And so the cartoon says, and that's why we need a computer. These are how many of you know about the game Sim City? Have you ever heard of that? Okay, this is a game that if you Sim City. I suppose you could simulate lots of things in it, but I don't know if they have that version out yet. These are fancy versions of computer simulations. I mean, computer simulations are done all the time. I mean, when they mark up a bill in Congress, they do a simulation of what the consequences of that might be. You may not agree with the results, but they are doing a simulation. Okay, so what I want to tell you about now is how we take these complex system techniques, which I'll describe a little bit, and we ask these questions about how social divides become health divides. And this is ongoing work with a set of colleagues at Columbia, Virginia Tech, University of Saskatchewan, and Argonne National Labs. And I have to say it's been funded generously by a number of places, NIH, Robert Wood Johnson Foundation, and the Institute for Integrative Health. And the kicker for all of this at the end of the talk is going to be that none of this would have been possible without this extraordinary organization that you're sitting in the middle of right now. And I'll come back to that because I don't want to, I'd like that to be the take-home message. So what do we do in terms of a complex simulation? First, we create an artificial world on the computer, and it has people in it, and it has places, and it has networks, and the places and networks have certain properties, and there are rules about how people behave and how they can learn, and you can think of it as a kind of game which is modeled on reality. Okay, and what we do is we use the most up-to-date information we can get to populate this world in terms of where people live, the kinds of neighborhoods they live in, how the places where they live depend on characteristics like age and race, gender, you name it, okay? We come up with diagrams that look like this. So let me walk you through this. So this is simply trying to show that income generates wealth, generates consumption, generates the quality of schools in your neighborhood, education level, social networks. These vary by race, and these then, lead to opportunities to exercise, eat good food, to smoke. This then affects the behaviors, which is where we usually put our attention, and then this affects disease. And there are all these connections between them, and what we try to do is to model those connections explicitly. We don't just wave our hands and say everything's connected to everything. We probe the literature, and we find the best available evidence about how each thing is connected to the next thing to its right or left. And I'm not going to go into this a lot. I'll simply say that everything is realistic in terms of the data that we use, okay? And so I'll give you an example. We have agents, we have individuals in this model, and an idealized agent might be somebody named Pat. And Pat in the model may go to school at age 6 and leave between 12 and 25, have a child at 25. All this can be varied. Gets a job, retires at 65, dies at some point, depending upon the life table for the US. Has friendship networks, can move from one neighborhood to another based on financial availability of housing, and preferences in terms of the kinds of neighborhood they want to live in, and then has health behaviors. So income depends on education and wealth of the family and friends. It increases through life until retirement. Households can accumulate or deplete savings and pass them on to their descendant. And then they have health behaviors, and behaviors depend on education and friends, who you know, where you live, and age, and then family characteristics. All based on solid data. These are very strong predictors. Now the first thing we do is we create this artificial world, and we want to know, well, are we even close to what we observe in reality? We've put all this together. It's dynamic. There's a lot of stuff going on. Are we on target? So we compare it with national data. So on the left we have age group in school. So this is age along here, and this is percent in school. This is from our model. This is from national data. We have income distributions seem to be very close to what you would expect from national data. Smoking rates are generally okay. BMI by age looks the same as you see in national data. So we feel pretty confident that we're capturing something about reality as we know it. But of course now we want to say, well, what if reality is different? Can we ask some counterfactual questions? When I started out doing this, the question I wanted to ask was, if poor kids went to good schools, what would disparities in cardiovascular disease look like in adulthood? Okay? There's a lot of steps in between that, okay? A lot of steps. So we asked some what-if questions. And so in the first thing I'll show you, we ask, will increasing quality of education improve dietary quality? And how do who your friends are fit in? And will the effects differ by race or ethnicity? We have blacks and whites in this model. These are preliminary. They're more illustrative than definitive, although it just got published. And so here's another more simplified version of the other model I showed you. And what we're doing is we're affecting school quality, and here we're using as a measure of school quality only one measure, which is student-to-teacher ratio. Not the only measure you might use. And then we're looking at diet, and all these things are affecting diet. The fact that you have these positive relationships means you have positive feedback, which can create an enormous amount of complexity in a model. A lot of stuff can be happening because everything's causing everything to change. So what happens? So we dramatically improve the student-to-teacher ratio in the worst 20% of the neighborhoods to an unreasonable level, 8 students per teacher, okay? And we allow diet to be influenced or not by your friends, And we use a measure called the healthy eating index. And then we run the simulation model for a while, get it going, and then we introduce this policy intervention, and we see what happens. The details, we run it for a long time. We actually go for several generations in the model, because there's intergenerational things. People are being born and die, et cetera. The simulation, it may not look that way, but it's so complex and dynamic. So much stuff is happening over time that we really don't know what results to expect. Okay? We don't know if it'll have any effect. It's better, we think this is better than just waving your hands and saying, well, if I do this, it'll do that. So let's actually ask. And we generate a whole bunch of plots. I'll walk you through one of them. So basically, blacks are in black and whites are in red. The dashed lines are without the policy, and the solid lines are with this school policy. And what we see is this dramatic decrease in the black-white difference in dietary quality as a function of improving school. We didn't do anything about diet. We didn't touch diet. All we did is say, if you go to a school that has higher quality, which then means something about where you're going to work, where you're going to live, the availability of food where you live, it's going to have a differential impact on blacks and whites. And in fact, dietary quality goes up in all cases. But the disparity, which is that difference there, actually decreases. So another illustrative example, what if we vary 3 policy dimensions now? We increase access to good food stores, we increase neighborhood physical activity infrastructure, we increase school quality. We have actually 125 different policy scenarios that we try. And these are not modeled like in a regression analysis. We have 2,500 runs over 110. We actually generate 500,000 data points. And each of those data points is independent of each other. They're not just run out by a model. Okay? So the outcome now is BMI. Okay? We want to know if we do all this stuff, are we going to improve BMI levels, and are the differentials, the disparities in BMI levels going to decrease? So we're affecting exercise, school quality, and good food availability, and our outcome is body mass index. And the first thing we note is that this is now the policy strength of each of these 3 different ones, is each of them has an effect in reducing the black-white BMI difference. Okay, so we're reducing it. But if we actually look at the runs, and this shows all 125 runs now on one slide, I hope you'll commit that to memory. There's enormous variation. It's like these are not equal opportunity interventions. And in fact, if we look at a particular combination of them, this is now BMI of blacks, and this is BMI of whites. Black BMI starts out higher, and in 20 years, we've eliminated the black-white BMI difference by affecting physical environment, the food environment, and educational quality. Another illustrative example, what if we, and this is topical, what if we vary income inequality so it more resembles that of Canada or Sweden? You've heard a little bit about income inequality lately. I started doing work on it in the mid-90s. So we're not changing anything else. We're just changing the distribution of household income. A hand of God comes down and redistributes income. I don't know how we do it, but that's what happens. What does it do to BMI? Well, the reason we wanted to ask this question is a number of years ago, we published analyses that showed that if we took the 50 states and we looked at a measure of income inequality, this is the income share held by the poorest 50% of the population, and then we looked at mortality rates, there was a pretty strong relationship. So Maryland actually looks pretty good relative to the other states in terms of income inequality. The further to the right, the largest amount of income held by the poorest 50%. So what does affecting income inequality do to BMI? Well, what it does, we now look at blacks and whites, and what we see is that this is the U.S., this is U.S. blacks, U.S. blacks if the income distribution was like Canada, U.S. blacks if the distribution was like Sweden. It actually makes a difference. And it doesn't affect whites very much, but it has a big effect on blacks. So this very, very upstream intervention of changing, I don't know how we'll do it, okay, but at least in proof of concept, sort of have fairer society creates a fair distribution of obesity. Okay. Now, we can continue to think about questions of obesity as if they were simply a result of energy input and energy output. Okay, that's the standard way of thinking about it. All we have to do is decrease this and increase that, and obesity will go down. But there are other people who believe that this is the true story in terms of obesity. This comes from the UK Foresight Group, and every one of these arrows has some literature that supports it. Obviously, we're never going to be able to do anything in terms of simulating this, but we've got to get further than doing just that. And that, in fact, is a tough chore, okay? And it's a risky chore, and we sometimes feel like we're falling off cliffs, but somehow we got to do it, okay? And I would say as we increasingly appreciate the dynamic complexity and integration of behavioral and social systems and their biological and physiological underpinnings, we will more and more be able to isolate independent causes, more and more unable to isolate independent causes through laboratory and community experiments, and will be less able to understand the impact of our efforts on population health and health inequalities. The in silico, that is in computer simulation of these dynamic, multi-level, multi-scale complex systems, can allow us to move beyond Einstein's Gedanken experiments, thought experiments, to a new understanding of the whole and its parts. The ability to forecast the consequences, both intended and, importantly, unintended, of our interventions and treatments, and a groundbreaking approach to integrative health. And I think we might get closer, that's Einstein's brain, by the way, we might get closer to a realization of Einstein, everything should be as simple as it is, but importantly, not simpler. And so what we're striving, I think, is to move upscale in terms of complexity away from these simple stories to a more complex story. And in doing so, I think we potentially can advance our understanding. Now, in terms of advancing our understanding, I want to underscore the impact of the Institute for Integrative Health. First of all, I want to thank Brian and Sue for their, I would say, their courageous and risk-taking efforts on this and their leadership. It really is quite an extraordinary organization. And I am seldom, if ever, among a group of people that are as diverse as I am when I come to these meetings. And you'd think, well, the standard protocol for a situation like that is everybody makes a speech and nobody talks to each other. But in fact, you know, there's tremendous interaction. And I've been involved in a lot of networks. I've been involved in a lot of government and private activities that try to bring people together. And I really, truly feel that this organization is unique in its success in doing this and in its bravery in doing it. And so I thank all of you, and I thank you for your time. And I guess, do we have time for questions? Or?
Yeah.
Okay.
So are there some questions? I think we have take a few before.
George, when did firm simulation modeling really begin? I remember back in 1966 at Michigan, we were doing this in regard to the future healthcare delivery systems and business modeling. How about in public health?
Well, I think what's different about these attempts is that these are complex systems models. They're not regression models, and regression models have a lot built into them in terms of assumptions and in terms of they're particularly suited for asking the billiard ball question. You know, what's the independent effect of X? Okay, and we can learn things from them. It's not, you know, I'm probably alive because of some things that have been learned from those. But there's this other way of thinking, which is, you know, interestingly enough, I went to some training in some software that's used for some of this simulation, and they were all business people, you know, like the biggest, for this particular software company, their biggest clients are McDonald's and Boeing, and you know, they have complex production and delivery systems, and they're so complicated that they can't figure it out without, you can't know whether a 787, is that what it's called, is going to fly, or maybe it's not doing so well, is going to fly or not. You can't, you know, build it and then see if it's flying, if it's going to fly. You have to try it out in advance. So these simulation techniques are used widely in certain areas of industry. They're used widely in terms of supply chain problems. In terms of public health, they have been most used in terms of infectious disease processes. We have people coming in contact with each other, transmitting things. They're suited for that. And what we're trying to argue is they're also particularly well suited for this nexus of important policy questions and important issues of inequality and health.
Yeah. Food, nutrition.
Yeah.
They're all things like food for the body. If you don't have any money, you don't have a job, you don't have 10 kids or 5 kids or whatever it is, we seem to have that situation. It's cheaper to go to McDonald's and buy dinner. And so it's really it's expensive to either grow your own plants, and that takes labor or whatever, and most people are not motivated. It's very hard to get healthy food for a little bit of money.
Yeah, and I think there are a lot of people working on that problem. I don't know that the FDA has been at the lead of that. And of course, food stamps are under a lot of challenge constantly. Now, when I first moved to Michigan, I spent 12 years in Michigan before I got back to the West Coast. And there was not a single chain grocery store in Detroit, not a single one. Okay? Now you may say, well, I don't want to go to the chain store, I want to go to, you know, some chi-chi, you know, artisanal green grocer. But the fact of the matter is the chain stores are a lot better than the corner stores. And I think there's now, Detroit may have one or not, I'm sure. But that is, these food desert issues are important. And when we blame people for not eating well, when we shake our finger at them and saying you're behaving badly without understanding the context of their lives, I think we do them a real disservice.
Yeah. Pretty hard to argue that.
Yeah. The problem is, let me just elaborate. There's a wonderful book written in maybe the 70s called The Undeserving Poor. And it tried to make the distinction between two ways of thinking about poor people. One, which came out of Reagan's welfare catalog, is that poor people are schemers, they make bad decisions, they're morally defective. The other view, which comes out of progressive social policies, is that poor people are just like you and me, they just have less money. And the social policies that come from that
Over here.
I'm sorry. Got somebody else.
Are you calling this one?
Oh, what you're saying just makes me think, because you mentioned food stamps, for instance, and food deserts, would it be a sensible public policy to say food stamps could buy you healthy food, but not other food?
Sure, they do that already.
Do that?
Yeah, you can't buy alcohol.
You can't buy
The food stamps. You can't buy cigarettes.
You can buy a hamburger for your dog, you can't buy dog food.
Right.
That's what food stamps do. Some people buy hamburger for their dogs.
Well,
They don't even
so-
eat their dogs.
Oh, anyway, that's the question I had.
And I think we have to look sort of upstream to people's choices to understand why they're making those choices.
Just a little word of optimism, and I don't know if Babs has anything to do with this, but they have a program in Baltimore for opening grocery stores in those waste areas. We have a young friend that just opened ShopRite in one of those areas, so they're now going to be able, with a grant, so they're going to be able to have food for an area where there was nothing except fast food in that area before. So
I think those are important.
just thought I'd add some
Important
optimism.
steps. What our simulations try to do is to show how far you can get with those kinds of steps versus other things.
George, thank you very much. I have two questions about your simulation. First, how do you know that all of your assumptions about causation are accurate and that you're not overlooking certain critical variables, particularly in regard to how race or ethnicity or social class affects some of those cause and effects? And second, how do you factor in unintended or unanticipated developments in the chain of causation that may occur down the road?
So let me take it at the highest level first and say that because of my education about complex systems, I no longer am convinced about the ways we think about causality. That in a complex system, take your computer. Short of pulling out the plug and knowing that everything will stop, it's pretty hard to know what cutting a wire here or taking out a transistor there or whatever a chip there is going to do. The systems have such a level of complexity that the language of causality, the sort of Humean kind of cause and effect, doesn't really seem to me to be very current. It's funny that you should ask the question about how do you know you have everything in it, because that's kind of what economists usually ask. I know you're not an economist. And the problem, is, of course, is you put in everything you know about, and you can only estimate what the effect of what you don't. And it's almost like the Rumsfeld, what was that quote? I can't remember the quote. Anyway, you can estimate how big other things would have to be to make things different. Okay. In other words, if you had something you didn't know about, how big would the effects have to be? And you can actually, in these models, you can do very, very extensive sensitivity analyses where you put in lots of different estimates of things and see how it affects. Now, in terms of unintended consequences, one of the contributions of this simulation, complex system simulation stuff, is the emergence of unintended phenomena that you wouldn't even have thought about. And that's often one of the benefits you can get from seeing this. It's not a closed system, it's an open system where lots of things can happen. You can't possibly predict everything that will happen, and you may learn from observing things that happen that you wouldn't have thought of otherwise. So, I don't know if I answered your question, Michael, or not.
Dr. Kaplan, I've often thought that social epidemiology was a golden well for informing the recreation of our healthcare and healing in this world and wider. I wonder if, and maybe I'm not right about that, so I'm asking you, is it true that it really hasn't received the honor it deserves, and is it possibly because it's such an interrelational way of thinking at its core, as opposed to, which is more of the feminine model of not the yang silver bullet? And is that a part of what's happening as we've tried to move into integrative healthcare? And is it essential that we understand that to form new paradigms and models?
Well, my own view comes from, of course, my own experience. And I would say that I started doing this work. I had some other careers where I did other things. I started doing this work in the early, let's say 1980, a little bit before 1978. And I would say in the 30, 40 years since then, there's been an enormous increase in the acceptance of social determinants of health. But if you were to look, for example, at the NIH budget, you would find they are minuscule rather to these extraordinary promissory notes that are being made about genomics. So I think, which have not paid off at all, as far as I'm concerned. So I think there is no escaping the fact that health is determined by a whole broad set of factors like that deck of cards that I showed. And that's simply an inconvenient truth that we have to live with. And to the extent that we deny it, we are missing opportunities to improve the people's health.
George, can I ask one question that's more an epistemological question, and this shift towards modeling something where it's really about the predictability and the persuasiveness of these models. So the strategy of using these models to make predictions or to speculate, if you believe your models, and you make them obviously as believable as you can, the nature of the complex system is that, you know, the intervention that you might have modeled would not, in fact, have the effects that you have predicted. So the question is, really, you've got a persuasive model. You're integrating these very complex, irreducibly complex issues, but we still know that without, you know, geospatial bucket, you know, is a good proxy for all of that. We still know that air quality will determine your lifespan better than any genome, right? So where can you act with this with any certainty? How do you use it to have the kind of political influence that these beg for, given their believability, their lack of predictability, and their irreducible complexity?
Yeah, I think that's a good question, and fortunately, it comes from somebody who knows something about this and knows how complex it is. There are a couple ways of addressing that. First, I would say that these methods, although they've been around for a while in some areas, are still relatively new to the policy arena, and to many areas of science as well. And with conventional methods, all the assumptions are in the air people breathe. It's a different kind of pollution. So they don't question them. They're there. You know, Marshall McLuhan said you don't ask a fish how it is to swim in water. It's just surrounds them. And as soon as you do something different, the conservative forces come out very strong in terms of saying, well, did you do this? Did you do this? Did you do this? Did you do that? So you get enormous pushback with non-traditional methods. I think that's true in, you know, a lot of areas. And maybe it's just a kind of a human characteristic. Now, so how do you make believable, how do you get people to believe these models? First of all, I think it requires training. And we don't do the amount of training in this kind of systems understanding that we need to do. I mean, your background is in engineering. Engineers do this all the time. We don't do it in talking about social systems or public health systems, which are crying for such approaches. The second thing is that a lot of what we do is still at the level, in these models, is still at the level of a kind of demonstration project or proof of concept, okay? In order to get, it may be no worse than a lot of the, you know, economic projections that are made, okay? But nevertheless, people think it is, okay? And I think what we need to do is to be able to have the kinds of investments in this work that will build what a colleague of mine calls industrial strength models. These are models that really capture a lot, enormous detail about the population, about factors, about air, about everything else. When we get those kinds of models, then we can start asking questions about what happens if this changes, what happens if that changes. And we'd be in a position of greater certainty in terms of making hard choices about what to do. Right now, we're still kind of in the proof of concept stage in public health, I think. Yeah.
Well, hi, Doctor. First of all, we want to thank you, to you, Dr. Berman, and to Sue, for once again holding this wonderful scholars program, and to you, Dr. Kaplan, for your really groundbreaking thinking. So this is what I got out of it, and then a question. What I got out of it is where you focus is what you see.
Yeah.
And what you see, you think that's the world.
Yeah.
So if that's your world, that's what you're going to operate in. So that then says where you're going to take action. Second, complex and complicated are not synonymous. So Mencken, who I have mixed feelings about,
Yeah, but I couldn't
for all
resist
kinds of
the
reasons, is not synonymous with complex.
Yes.
So if you say something's complicated, your immediate response is to go reductionist, to break it down to the most simple element and to take action in that. So complicated is a reductionist thinking. Where you're talking about complex takes you more to a more comprehensive thing. And I don't think we know what to do with complex, which then takes me to my question and your sim city. I had to be sure I heard it right. I thought it was sim city. I could get a lot of people to come to a sim city simulation. So the question is, what do we measure and where do we intervene?
Yeah.
So in your story about Marva, your story about Pat, at the end you asked what was her body mass index, the BMI. Well, but what about her reading test? What about her math skills? And if you're with kind of the Arnie Duncan school of thought, which is race to the top or race to the test, you don't care about her body mass index. You care about her reading scores, her math scores. Teachers are going to be evaluated on it. Teachers could be fired. Money could be lost, etc. So my point is that what is it that we're going to measure? Because if we measure only body mass index, well, that's one thing. So what is it that we measure, which tells the story? The second thing is, where do we intervene? Now, I'm going to postulate something to you. This is my question, which is, if we don't want to be complicated, and we don't want to be simplistic, and we don't want to do the silver bullet, you still have to intervene somewhere. So where do you intervene? And I'm going to give an idea, and then tell me what you think. I think it's the schools. So schools. So you can bring in new food opportunities. The Marsh family on North Avenue that I saw on my way over has tried to do something different on North Avenue. So you can have different kinds of stores, but unless you know what to do in the store, unless you know what to do with food stamps, there you are. Then there's the schools, the cafeterias, or whatever. Arnie Duncan is saying race to the top, race for the test. So my whole point is that what Dr. Berman has tried to do, which is the school, not as a school, but as a settlement house. A settlement house for both the children, the parents, and the teachers. So remember, the teachers aren't making a lot of money. They're actually lower middle class. So whatever you're going to do to introduce the students to a different way of life, and a different way of thinking, then you're also bringing in the teachers, because the teachers see that the kids are having fun. Dr. Berman, like your Patterson Park initiative, which I think is an amazing initiative. So I offer that to you. So one, where do you measure? I'm not, okay. And measure doesn't tell the whole story, we know that. And then where would you intervene? And do you think the schools are a good place? And do you think Dr. Berman's onto something which
First of all, I thought it was interesting you mentioned settlement house, because in fact the settlement houses were socialization instruments. They were to take the unwashed and to make them like white people.
No, I think they were trying to teach them to be Americans.
Okay, Americans.
The original settlement house movement was to take people who were new immigrants
Right.
and help them learn citizenship and the folkways and mores in the United States. And also have fun.
Sure.
Like have fun,
Right.
like rather than.
So you asked me where I think we should intervene. I think the fundamental problem is one of opportunity structures. And the opportunity structures, the lack of opportunity structures permeate neighborhoods, schools, everywhere you look. And we need to have, I know you know the famous quote about one-handed scientists, right? Somebody was testifying before Congress, and somebody came up, and someone from the panel came up, and they said, you know what, Dr. So-and-so, what we need are more one-handed scientists. And I said, what do you mean? He said, well, you guys are always saying on the one hand there's this evidence, on the other hand there's this evidence. But I think there's so many ways in which opportunity is blocked in our society that we need to really intervene on lots of those ways. Now, schools are important. There's no question about it. And I think a lot can be done in schools. And I think we can model both what they call cognitive and non-cognitive skills. So the facts, as well as the skills that have to do with planning and thinking ahead and delaying gratification and all that kind of stuff. That can all be done. But I actually think that I'll go back a little bit. I did a long series of studies years ago where I showed that 2 simple questions about how hopeful people felt predicted a broad range of health outcomes. They predicted whether they became hypertense. They predicted whether they had thickening of their carotid arteries. They predicted whether they had strokes. 2 simple questions. And I think to the extent we can intervene on changing people's perception and awareness of what opportunities are and giving them opportunities to go to school, to have good jobs, to live in neighborhoods where there's, exercise and good food and all that, we're going to be ahead. So I think we can close prematurely on schools, although I think schools are very important. Now, what do we measure? I think it depends on what question we're answering. We chose diet and BMI because they're so prominent in the public health literature right now. Would I look at school outcomes? One of the
See, I'm going to change that. I'm going to stop thinking about the public health or public education and think about the public life.
Yeah.
In other words, if you look at Marva and if you look at Pat, if her reading scores go up to where she ought to be, and her math scores are where they are, and she can go to a library where she can learn, and she walks into the cafeteria of your schools like the Patterson Park, and learn about cooking with her boyfriend there, or maybe not her friend or whatever. And her mother says, oh, this is changing. I want to be part of this. And the teachers say, why do the kids have all the fun? So you see, but as long as this is the fight we had in Congress. We have many fights in Congress. And we had people come in public health, and they sounded like a 1992 public health textbook. They talked about obesity, and they talked about smoking. And I think that's great. I don't minimize this. But unless we think exactly what you said with complex.
I agree with you completely. I think those are proximal targets, the behavioral stuff, and it's what public health people beat their head bloody trying to change. We made some victories. Smoking was a huge victory, I think, in 40 years to go from 50 or 60% of the population smoking to single digits in some places. But that's an outcome, not a cause. But if kids in schools and in other venues learn that they can make goals that are achievable, that they can learn things that allow them to achieve those goals, that they're mentored by supportive adults, if we do all those things, they're not going to end up smoking. They're not going to end up fat. So I think that's my theory. Yeah, right. So I think we agree. Yeah. And just in terms of complicated and complex, I thought it was interesting you picked up on that because it was a little slip on my part. They are different, and the distinction people make is that you could have a spaghetti plate of lines of everything connecting to everything, but they could all be kind of simple relationships where one thing causes another. That's complicated, but it's not complex. Where you get the complexity is where you have what they call nonlinear dynamics, where the effect here, small effects here may have huge effects here, where all these things cascade, where they interact, and then that creates a situation where it's hard, absent some simulation or some model, to predict what's going to happen. And we have so many policy failures because we can't do that, I think.
So, George, I want to thank you for an amazing presentation. I want to thank you for your great contributions to the Institute over the years and for what you do for the